much, Mr. Speaker. My question's for the Premier this morning. Premier, over the last 2 years, we've seen 200 positions and over $20 million cut from the local hospitals in the Quinte region. We're talking about one of the largest retirement communities in the province, one of the most visited for tourists, and one of the largest communities for veterans in Ontario. 162 positions, including nurses, were cut just last week at Quinte Healthcare. My constituents who use Prince Edward, Trenton Memorial, and Belleville General Hospitals have seen bed cuts, service cuts, and nursing jobs being cut. So, Speaker, my question basically is to the Premier, how much tighter can she put the screws to Quinte Healthcare before she breaks these small rural hospitals?
Thank you.
Minister of Health and Long-Term Care.
Minister of Health and Long-Term Care.
Thank you, Mr. Speaker, and I want to begin by saying that my expectation as the Minister of Health is that our hospitals have a responsibility to ensure that the patient care that they provide is of the highest quality and the services are there to meet the needs of their communities, and that includes the 4 hospitals that the member opposite is referring to that come under the umbrella of the Quinte Healthcare Corporation. Now, it's true that QHC has been working to manage within their budget. They have, of course, the member opposite talked about the eliminated positions that are being proposed at this stage. Mr. Speaker, they've had conversations with the unions involved. He talks about the job losses. He, of course, left out the fact that 38 of those positions are actually vacant today, and also they are creating 78 new positions. He failed to mention that, which has a significant impact in terms of it. But nonetheless, and notwithstanding that clarification, I'm working very closely with the member from Northumberland, Quinte West, on all of the hospitals in the region, including the Trenton Hospital, which is a hospital which is being affected by these changes.
Please supplement.
Mr. Speaker, that answer is just not going to sell in the Quinte region. Over the last 5 years, you've cut $36.5 million. How do you expect to maintain the same kind of service that you say you expect when you've cut that many jobs from our local hospitals? And don't take it from me, and don't take it from the grassroots efforts that are underway in the Quinte region, or even the Ontario Health Coalition. Take it from the emergency room doctors at those local hospitals who have sent a letter to Quinte Healthcare saying that the cuts are definitely going to impact patient care there negatively. The Minister of Health was happy yesterday in the Belleville Intelligencer to say, we've always maintained the expectation is that service to patients will not be impacted. But when you're making those kinds of cuts, Mr. Speaker, it has to have a negative impact. I would like the Premier to stand up because she's the one in charge over there. I would like her to guarantee no more cuts, no more shortfalls at local hospitals in the Quinte region, or do I just have to set an appointment to Dr. Hoskins for next year to learn about the latest cuts?
I wouldn't mind the member when I stand and stop. Minister of Health.
Well, thank you, Mr. Speaker. And again, the member opposite neglected to mention that last year, due to budget pressures, we stepped in with $3.9 million of mitigation funding to Quinte Healthcare. We're likely going to be doing the same as well as they face these pressures, because there is that expectation that the quality of services don't suffer. Now, a year ago, we had discussions that resulted in me providing additional funding for one of the hospitals that the member opposite was concerned about. But I have to say, over the course of this calendar year, I haven't heard a word from the member opposite about Quinte Healthcare Corporation or the 4 hospitals. But I have, almost on a daily basis, been working with the member.
The member from Prince Edward Hastings is warned.